R.L.M Ross. Welcome back to another episode of Deliver Me, the video series. Today, we're going to address Chapter 5, Pain Management in Labor. Now, the basic pain management tools that we use now in 2021 is the epidural. Most people, I'd say 99% of the patients I take care of want an epidural, and it usually gives them very good pain relief, and they go on to have a nice uneventful delivery, labor and delivery. But from time to time we get patients who come in who have different questions. They've had had conversations with friends who, some of them haven't even had babies, and they telling them, don't take the epidural, it's going to make you paralyzed, it's going to hurt, give you problems with your back. And we have to look at them. Well, I usually say to them, the person who told you not to take the epidural, did they have an epidural in labor? And they'll tell me yes. I say, well, that person is not your friend, because they got the control and pain relief from the epidural, but they don't want you to take it. However, to address the question of whether you can get paralyzed from an epidural, so far in 30 years, I have not seen it. I will not sit here and tell you it cannot happen, but I don't think it can. And it is not one of the side effects that is discussed with the patient when the anesthesiologist meets with them to discuss the epidural procedure. What you will have is local discomfort. You're going to stick a needle into the lower part of your back. It's not a very tiny needle. So once they're done, that's going to hurt a little bit when they take it out the next, when the catheter is removed and you start moving around again. You're going to feel some soreness, similar to the soreness you will feel when the IV is removed. I've heard, like one of my colleagues said that when she had a spinal. And spinal anesthesia is what they give you for a C-section, which is a little different from the epidural because it's what we call a denser block. So you're really numb. And they do that so that you can be awake to deliver your baby, but you can't feel anything other than people touching you and maybe a little pulling and tugging. But you don't have the pain that you would have if somebody was cutting your body with no kind of anesthesia. So she said that when she was getting her spinal, depending on the nerves that the needles brush, you can sometimes have some sharp pains in your legs. That was not my experience, but everybody's experience is different. So while it won't paralyze you, you may sometimes have these shocks as they are introducing the catheter. And they tell you to expect that, and it's a normal part of the procedure. But it is not a reason not to have an epidural. It does not cause paralysis. The medication wears off for an epidural once we turn it off. Within an hour, you get sensation back in your legs and you're starting to feel pain and discomfort and soreness and all that kind of stuff again. Spinal takes a little longer for it to wear off, but that is because you need that kind of block to help you manage the pain that comes as a result of a C-section delivery. What are some of the common side effects of an epidural? The one common side effect that will be discussed with you by your anesthesiologist when you get ready to do this procedure is what we call a spinal headache. And that is sometimes the epidural needle punctures the spinal column, because for the procedure, the epidural needle goes into the epidural space. It does not go into your spinal column. But sometimes it might go in a little too far and it nicks the spinal column, and you might lose what we call cerebrospinal fluid, a little bit of it. And that whole circuit with the cerebrospinal fluid, it speaks to it, is the fluid that runs from your brain down to your spinal cord and it goes back around. And it's not blood, it's cerebrospinal fluid. And something, if you lose a little of it, it has to be replaced, because then it causes an imbalance in the pressure, and that is why you have the headache. But it's something that can be easily fixed. and your anesthesiologist will discuss this with you. This is one of the things they tell you about. Other things that can happen as a result of an epidural, which are extremely rare, and I have yet to see in my 30 years, an infection or bleeding in the area. And this is why if some patients have certain disorders that affect their bleeding, like platelet disorders and that kind of thing, some of them may not be able to have an epidural. But all of this is something that you would discover throughout the course of your pregnancy, because they would be testing, doing blood tests regularly if they see that this problem exists. And sometimes it can even be treated where they'll give you steroids to help to boost your platelet count so you can have the epidural for labor. But these are things that you must discuss with your doctor, or your doctor will definitely discuss with you if you are a patient who has these conditions. But for the most part, epidural is pretty safe. It is a wonderful tool. I'm thankful that in my 30 years it has evolved to the point where it is, because it gives people very, very good pain relief, and they can go through and have their babies without, you might still feel a little discomfort when you start to push, but there are people who feel absolutely nothing and the baby comes out and it's like a wonderful experience for them. That brings us to the end of this episode of Deliver Me, the video series. To secure your copy of the book, head over to Amazon.com to order, where it is available in paperback and Kindle versions. For more information, or if you'd like to ask us a question or leave a comment, please follow us on Instagram at R.L.M Ross Books. Like our Facebook page at Deliver Me, the real deal from an L&D nurse, or email us at rlmrossbooks@gmail.com. Thanks for tuning in. See you next time. And thank you so much for your support.
Labor and delivery, deliver.